Have you ever been in the situation where you're getting your cardiac surgery patient out of bed for the first time since their surgery, and when they stand up, they start to get really heavy, and you look at the monitor, they're bradying down, their blood pressure is going down, and it seems like they're going to code. So let's talk about why this happens with post-op cardiac surgery patients and what we can do to mitigate it. When we get somebody out of bed, what ends up happening is we get a lot of blood that actually pools in the legs, decreases preload, decreases cardiac output, and with that, we get a decrease in blood pressure. But what happens with a normal person is our baroreceptors will sense this and increase the heart rate in order to compensate. But in post-op cardiac surgery patients who have gone on bypass and had their heart manipulated, there are several things that happen. First, they don't have very sensitive baroreceptors. Our baroreceptors are not responding as well whenever this happens, so we don't see that increase in tachycardia when low blood pressure is sensed. Also, since we do have manipulation of the heart, sometimes we do get increased vagal stimulation. So that means whenever somebody's standing up and they're holding their breath, we get increased vagal stimulation, causing that bradycardia. Along with these baseline issues, the fact that the patient is in pain and probably very anxious can cause them to hold their breath and increase that vagal stimulation as well. And then we see that decrease in heart rate and that decrease in blood pressure, which could lead to the patient passing out or sometimes even coding. So what can we do to help mitigate this from actually happening? The first thing that we can do is move the patient very slowly. Getting them up as fast as possible is going to cause more pooling of the blood in the legs and be worse off for what we're trying to do anyways. So we want to slowly transition them from laying down to sitting up, then from sitting up to standing, and then slowly making our way to the bed. And sometimes if we can just pivot from the bed to the chair, that is often the best practice. The next thing that we can do is treat the patient's pain and anxiety and coach them through breathing techniques. If we treat the pain with medications and other techniques such as splinting with the heart pillows that we give out, this is something that can really help decrease the chance that the patient is going to vagal, as well as giving them good breathing techniques and coaching in order to help them stop from holding their breath. We also need to make sure that the patient is fully resuscitated before we start getting them out of the bed. So if they are dry or if they are intravascularly dry and they have third spacing going on, we need to make sure that they have enough intravascular volume in order to tolerate this movement. And finally, if your patient has a pacemaker, please make sure that it is on and the battery is in and the leads are plugged in so that if the patient does brady down, the pacemaker can take over and help compensate for that bradycardia.